my name is Karin Lykke-Hartmann. I am Associate Professor in the Department of Biomedicine at Aarhus University in Denmark. I've been working for a long time with the ATP1A3, and it started more than 10 years ago when we started making some basic mouse models of some of the mutations. So back when we started, we didn't really know the association with the AHC, but that came during the making of the mouse modeling. And then it turned out that the mouse model that we created was a really good model for AHC, and we have been studying this extensively. And during the process and coming up with the ATP1A3 symposium, we got well connected with clinicians and with parents and patients. So now my interest is broadened into a lot of translational disease research, and keep contact with patients, trying to see what do we need to develop to overcome and cure this disease. So I'm very interested in gene therapies, and having a mouse model is an excellent experimental tool to start out with. So we are working a lot towards more gene-based therapies. In particular, I'm very interested in applying the gene-based editing method, which is quite new. You go to the genome and you make a little substitute of the mutation to kind of repair the mutation at the DNA level. So this is one of my hopes and dreams, so that we can use this AHC model that we created to really apply the gene-based editing techniques in addition to the other approaches that are going on now, which we have heard on the meetings with the gene therapy, and we also heard about the compound screening, we heard about the stem cell therapies, we heard about drug discovery through structural protein analysis. I think gene-based editing is really one of the new big thing that can cure diseases like AHC. So the AAV is the one which we call gene therapy, which means that you add an extra copy of the gene on to the cells. And so the efficiency of a potential treatment will depend on the nature of the mutation that the disease is caused by. So if you have a disease mutation which we call loss of function, means that you will have a mutation that will give you a little bit less protein. Then the gene therapy, what you call the AAV, will be very helpful, because it means you will add more protein to the cell, and you will get the levels up to a normal levels. However, if you have one of the more gain of function mutations, some of those that destroy the cell, have an unwanted function, it does not really matter that you add more protein, because the mutation will still be dysfunctional and even sometimes be down-regulating the normal proteins. So when you then have the gene-based editing, it means you go into the DNA. It's what you can use. You can use the CRISPR-Cas technology. This is quite a new, well, not so new, but fairly new technology that is being used now to go into the genome, so where the genes are coded, and then you make a little editing. So that means that you completely eliminate the mutation. So you will have no more protein made with the mutation. So I think this is very promising, and this is something that is really upcoming. There are still some challenging to overcome, but I think for even all treatment that would be challenging of targets. So, I mean, basically this was the really big core of this meeting we had in Reykjavik just now, was to really go into the different kind of therapies. How can we apply them, and what would they work on, right? Because the mutation that cause AHC are a little bit different. So we need to think eventually that they could actually require different treatment in terms of therapies. And this is the really main focus that we need to focus on right now in terms of getting towards a more permanent treatment of AHC.